Minister, a 78-year-old woman who suffers from cardiac issues had to wait over 24 hours in a chair at University Hospital, Waterford. The woman, who was subsequently diagnosed with heart failure, arrived at University Hospital, Waterford at 3 p.m, but still had no bed or trolley at 3 p.m. the next day. She travelled from Dungarvan with her daughter, and she told Damien Tiernan on Daysha Today on WLR her story. She said, and I quote, "Mam went through triage very quickly, but then we sat and sat. Mam sent me home at 11 o'clock as I had to go home and do the jobs at home. So she told me that she would ring me when she was ready. At 2 o'clock in the morning, she rang me and she said, 'They told me I'm staying in.' I asked her if she had a bed as of yet, to which she responded no, though she was hopeful that it wouldn't be long before that came about. I said I would give her a ring in the morning and I went to bed. I got up at 6 a.m. and I was working at 8 a.m, so I said I would go down first with a bag for Mam. When I got in the door at 7 a.m, I looked through and there she was, still sitting in the same chair. A 78-year-old woman who was later diagnosed with heart failure left for over 24 hours, not on a trolley, but on a chair in a hospital. And the Minister, who hasn't come to the Chamber today for whatever reason, the Minister for Health, tabled a very lengthy amendment to our motion, but he left out a number of very important facts. Nowhere in his amendment does he agree or does he state that 85,000 patients had their procedures cancelled for the first quarter of this year. Nowhere does he talk about the thousands of patients who are languishing on hospital trolleys every day, record numbers being broken every week, every month, averaging at about 600 or 700 a day. Nowhere does he talk about the 50,000 bed days that were lost due to delayed discharges. Nowhere does he talk about the average wait time in emergency departments now exceeding 11 hours, and for children over 13 hours, and the same for patients over the age of 75. And nowhere does he talk about the 24,000 patients for the first quarter of this year who left emergency departments without being seen. And the facts are, Minister, that the Minister for Health doesn't have a plan. He certainly doesn't have the confidence to come into the Chamber, because I think this is the second private member's motion in recent times on health that the Minister for Health himself hasn't been here, and you would have to ask what his priorities are. So I'll tell the Minister for Health, and I will give him advice, which I've done time and again, on what I believe he needs to do. And there's 4 key issues that we're asking the Minister to deliver on. One is to increase hospital capacity. This Minister loves to talk about stuff that he's doing and talk up some of his successes, and we see this in the very lengthy amendment that he tabled to this motion that doesn't acknowledge any of the hardships or any of the crises in emergency departments or hospital cancellations, or what those on the front line are going through, or what patients are going through. We need more beds, we need more surgical theatre capacity, and we need more diagnostic capacity. And yet there is no pace or urgency on delivery from this Minister for Health. Lots of promises, and we're always waiting, but no delivery. We also need more investment in community and primary care. One of the reasons that we have a crisis in emergency departments is because we don't have proper care being given to people in the community. We know we need more out of hours GP care, greater use of community pharmacy, more step-down and recovery beds, and more care options, including rehab in the community. Minister, we need a comprehensive workforce plan for health, where we need to ratchet up training places to ensure that we have a greater graduate and pool of graduates coming through, because we simply cannot deliver on what we need to deliver unless we have more qualified health graduates coming through. But to underpin all of that, we need a multi-annual plan, and a multi-annual plan that gets serious about integrating all elements of healthcare. We have primary care and community care operating in silos to what's happening in our acute hospitals, and that's one of the big failures. So this Minister needs to have the courage of his own convictions and come into the Chamber when there's debates on health. But more importantly, he needs to actually come in with a plan, and he needs to deliver, because patients and those on the front line are suffering. Thank you, Carl.
6 speakers left. Sean Crowe, 2.5 minutes. Deputy Crowe.
The Oireachtas Health Committee has consistently heard from health service workers and their unions that staff are at constant risk of burnout. Recruitment and retention remains at crisis levels as young graduates seek better pay and working conditions elsewhere, despite their express wish to remain in Ireland. This is making it a possibility to legislate for mandatory staffing levels in hospitals, as what staff we have we cannot keep and are increasingly unable to replace those that leave. If we don't have key staff, then hardly any other initiative is going to make a meaningful impact on the healthcare reform in this state. There are nearly 900,000 people on a waiting list, out of a population of around 5 million in the south. 1 in 5 people waiting on a waiting list, some for months, others for years, often in pain, many on heavy medication and suffering further, waiting on procedures or elective surgeries that could have a transformative impact on their quality of life. And the longer we leave them on waiting lists, the greater chance there is that complications will arise and that their health conditions will get worse. One constituent, a double amputee that I was dealing with recently, was trying to gain access to an obesity clinic, and he will have to wait for years. The longer that they go without treatment, patients, could lead to things getting worse, could lead to heart conditions or organ damage. By leaving people on lists untreated, we simply create more for the services down the line. It's both inhumane and makes no sense on a medical or a financial perspective. We need a real and actionable plan, and the current government's policies have us bouncing from crisis to crisis, and it's ordinary workers and families that are suffering. We need a 5- and 10-year health service capacity roadmap, and we need to know what we need, when we're going to build, and how much it's going to cost. We cannot repeat the mistakes of the past that have led to a still-to-be-finished children's hospital, already being the most expensive in the world. So we need a strategic workforce plan. Am I near time? No, sorry.
You're just on time.
Okay, so we need a strategic workforce plan which develops, trains and retains the doctors and nurses and allied health and social care professionals. We need to safely staff and the health service and deliver universal health
The next
service.
person listed is not here, Deputy Gold.
Minister, we're facing a perfect storm in the health service, a lack of community care, increasing pressure on already overburdened hospitals. In the first 3 months of this year, in Cork hospitals, almost 6,500 beds have been lost because of delayed discharges. This has led to 1,900 cancellations in hospitals, and the figure doesn't even include the CUH. So let's be clear. Each one of these figures is a person, a human being that is suffering because of this government and this minister's inability to do his job. I supported a constituent who for 3.5 years has a colostomy bag that should have been removed, that has had the surgery cancelled 3 times. He can barely walk and he's in constant pain, and he's a carer for his sick wife. This is the reality of people living through. I have another man who contacted me yesterday to say his wife had a terrible fall a few weeks ago, breaking both her arm and her wrist. She's 79 years old. He says she couldn't see because she's waiting 4 years for cataract surgery and no sign of it. And he said, can I get him information, because she'll have to go to Belfast because this government can't supply the health care that they need. And the tragedy here is he was after suffering a stroke. She was his carer. He's 81, she's 79 now, and they're being abandoned because of your inaction. And it's not alone that. I have another lady. This is unbelievable. Her mother being treated for life-threatening sepsis, spent 4 days on a trolley. She 82 years old with dementia. How terrified was that woman, and how terrified was her family? David Connell has a plan. We're asking now for the love of God, will this government ever listen to constructive proposals, take on board? We want to work with the government. We want to work with the minister, because if you don't take us on board, you're failing the people.
Minister, your colleague, Minister Stephen Donnelly, isn't here tonight. At the Business Committee last Thursday, I made it clear that this PMB was going to be on hospitals relevant to Minister Stephen Donnelly. He hasn't given any apologies to my colleague and our spokesperson on health, David Cullinan. So I think it's just really disrespectful. What's happening in our health service is having a profound impact all across this country on families, and it's incredibly cruel also on the doctors and nurses who are carrying this impossible burden because they don't have the necessary supports that are there. I want to talk about Letterkenny. We're extremely concerned about Letterkenny University Hospital in Donegal. Extremely concerned about the conditions in the emergency department, about the lack of doctors, nurses and beds, and we've raised it year in, year out. What's happened in recent days, though, is really shocking. We had a situation where we had one consultant endocrinologist dealing with a massive burden of diabetes patients in Donegal. The clinical advice is that the waiting time should be 6 months for an adult with diabetes for an appointment, just 6 months, and that's long enough. In Donegal, they're waiting 24 months, which is extremely dangerous. We know all the work on diabetes means that the earlier that you can intervene, the more support you can put in, the less the impact down the line. So we had one consultant endocrinologist working his socks off. Recently we had a second one appointed. Within weeks they resigned, and now the existing consultant endocrinologist is going to. So we're without a support service of any substance in Letterkenny Hospital. So people were waiting 24 months and now they could be waiting even. This is an absolute, I can't stress, an absolute crisis. The Donegal branch of Diabetes Ireland have spoken out about this yesterday, and they met with Stephen Donnelly when he was last up in Donegal. So I'm appealing to you, Minister, to please speak to your colleague, Minister Stephen Donnelly, to make him aware of what the Donegal branch of Diabetes Ireland are appealing for, that is an urgent intervention from Minister Donnelly with the hospital to make sure that there's necessary diabetes care supports. It's absolutely urgent at this stage.
Minister, the health service is in crisis, and action taken by this government hasn't made it any better. You just have to look at hospital waiting lists, people left on trolleys, people waiting in A&E, mental health services, early intervention and assessment of needs of children, and the list can go on and on. The system is beyond breaking point, and no amount of tweaks and small changes are going to cut it this time. The only thing that's holding our health service together is the dedication of our frontline staff. Minister, people deserve a state-of-the-art health care system, but I'm afraid the system we have is falling way short. And we don't have to look too far to find concrete examples of a health service that's failing its people. My own local hospital, Beaumont, had to cancel nearly 5,000 appointments in the first 4 months of this year. Roughly 50% of people attending Beaumont Hospital Emergency Department were left waiting for over 9 hours just to be seen in the month of January, February and March. Patients over the age of 75 waited to be admitted to the emergency department on average of 17 hours in the same period. The reality is, Minister, that this government and the Minister has failed our health service miserably. This motion calls for the government to immediately legislate to make sure that there's a mandatory safe staffing levels in our hospitals. This is in the interest of the safety of both workers and patients. You must also develop a multi-annual plan that sets out a roadmap for increasing capacity over the next decade, and a strategic workforce plan to go with that too. Minister, the solutions are there. And we in Sinn Féin have handed you solution after solution time and time again. But it's time now for the government to open its ears and to act in the interest of its workers and patients in the healthcare system.
I'm going to concentrate my brief limited time on mental health and the waiting list on mental health, Minister. Currently, at the moment, we're at a record high of 4,490 young people who are currently waiting for an appointment with CAMS. 752 of these children are waiting for over a year. I repeat that, 752 children are waiting for over a year for a mental health appointment. These were figures that I received at the end of March. I also received figures in February, because I've been mapping this for the last while, and the figures are only going one way. Between February and March, there was a 1.2% increase, but what really concerns me is there was an 8.6% increase in the amount of young people who are waiting for over a year. It's unacceptable for one child to be waiting for a year for a mental health appointment, never mind 752 people in this country. If a young person hurt their head or cut their head, they would be seen to almost immediately. But if they had an issue going on inside their head, they would not get the same level of care. We need to see parity of care between mental and physical health. Minister, CAMS is for young people with moderate to severe mental health problems. And Minister Butler, who's also not here tonight, I need to point that out, has pointed out numerous times that the amount of referrals have gone up, and that has contributed to the increase in the waiting lists. But what seems to happen is the government can't seem to join the dots. If children don't get the early intervention at the very earliest stage, they're going to need the more specialist treatment like CAMS. So, for example, at the moment, there's 11,000 young people waiting for an appointment with primary care psychology. There is 4,000 of these children are waiting for over a year. Primary care. We have jigsaw 30-week waiting list in some areas. We have emergency departments inundated with the amount of young people who are going there with mental health crisis under this government. This has never happened before. Minister, we can all get lost behind stats, and it was mentioned already, and I have to say it, behind each one of them statistics is a young person. It's also a young person with a family, and this ripple effect is going from right through the family. But this young person has hopes, dreams and ambitions, but they've been denied the opportunity to reach their full potential under this government.
Concordia, Sinn Féin's motion seeks to address the escalating crisis that has crippled the HSE, the tragic scandal of hospital overcrowding and growing waiting times. Minister, our people are suffering, and in particularly our elderly. I'm my party spokesperson for older people, and older people are forced to endure waiting times in this hospital that can exceed 20 hours, Minister. The government's answer to this disarray is record cancellations. They mistake activity for action and cancellations for solutions. Hospital waiting lists are going the wrong way, and with each passing day under this government, the situation is worsening. Instead of treating symptoms, let's address the root cause. Patients languishing on trolleys, procedures being cancelled, growing waiting lists. They are not isolated issues but interconnected symptoms of systemic failures. Sinn Féin envisions a new trajectory, one defined by comprehensive reforms, increased accountability and patient-focused solutions. We propose the following: a sustainable multi-year capacity plan. This means more hospital beds, over 1,000 more than we have today. It means surpassing the government's short-sighted goal of 1,500 beds and aiming for 2,500 that the ESRI believes is the need. We are committed to building a health service that is both reliable and resilient. We seek to develop and retain professionals who will become the backbone of this service. It is also time, Minister, to accelerate sláinte care reforms. Let's aim for a system where more care is delivered outside of hospitals, where outpatient appointments are managed in dedicated clinics untouched by the turbulence of emergency departments. Show our health service deserves safeguarded spaces for elective procedures and outpatient appointments. We must limit the impact of unscheduled care to prevent the chain reaction of cancellations that we are witnessing today. Therefore, Minister, I am asking the Government to not oppose our motion, but to instead see this as a way to put people's health first, especially our older people who need the most care in this delicate period of their lives.
Sinn Féin, Brian Stanley.
Thanks, Cora, and I welcome the opportunity to speak on this motion. The reality is, Minister, is that we have 888,000 people on hospital waiting lists. Record waiting times, record numbers of people leaving emergency accommodation without treatment. And we got the figures this week on that. Figures released to us in Sinn Féin show that 497 people left Portlaoise Emergency Department between January and March 2023 without being treated. And in Tullamore, 546 people left the emergency department without being treated between January and March of this year. Now, these are alarming figures, Minister. And this is despite the best efforts of the frontline staff in both of those units, in the emergency departments in both Tullamore and Portlaoise. The trolley scandal, which your department, which your government pledged to end, is now worse than ever, and it just be January and into February maybe, but now it has become an all-year-round threat to patient safety. We need an immediate increase of 1,000 hospital beds, with a total of 2,500 additional beds needed, required over the next couple of years, according to the ERSI. One solution that I've consistently put forward is the need to improve discharge times. To do this, we need to increase step-down capacity to free up beds in the acute hospitals. And in Portlaoise, between January and March this year, we lost 671 bed days due to delayed discharges, compared to 506 for the same period in 2021. So it's got worse because we don't have the step-downs and community care. The situation in Portlaoise has deteriorated, and while the bed days lost in the same period in Tullamore has shown a reduction over the 2 years, which is welcome, there's still at 428 days lost in that 3-month period. That is too many days lost. These figures underline the ongoing scandal of the 12 step-down beds that are supposed to be delivered in Abbeyleix nursing unit, the hospital there. They've still not opened. I raised it last week with Bernard Gloucester, the CEO of the HSE, and impressed on him the absolute importance of doing this. And anything you can do, Minister, to push that on would be very welcome. We need to free up these step-down beds. What's also delaying discharges is the lack of home care packages. People who are ready to be discharged can't leave because they don't have a home care worker. And we need to fix that situation. The health services can be fixed, but it needs a government and minister with the political will to do so. Sinn Féin believe that we need to drive on the reforms contained in Sláinte Care, increase bed capacity, and hold the health services to account, and bring a proper pipeline of workers and train and retain an increased number of those critical healthcare staff. Minister, we must increase capacity.
The constituency that I represent of Dublin North West is served by 3 hospitals. The Mater Hospital is a teaching hospital that provides acute and tertiary specialist services for approximately 190,000 people. The Mater is also the national centre for a number of specialities, for example, spinal injuries, cardiac surgery, heart and lung transplantations, and it is the home of the National Isolation Unit. Beaumont Hospital provides emergency and acute care services for a catchment area of around 290,000 people. It is also a designated cancer centre and a regional treatment centre for a number of other medical conditions. Finally, the National Orthopaedic Hospital, CAPA, provides a national orthopaedic service for the treatment of lower and upper limb and spinal injuries and surgery. Across the country, hospitals saw record levels of inpatient cancellations over the winter months. The health system was put under extraordinary pressure with an emergency department crisis. Almost 45,000 inpatient appointments were cancelled across December and January, while hospitals experienced one of the worst overcrowding crises seen in Irish hospitals.
The obvious consequence of such cancellations is that a massive backlog will result, that this backlog will continue to be a source of crisis in the health service for many months to come. This has proven to be the case. The number of appointments and procedures that were cancelled in Q1 for 23 for the Mater Hospital amounted to 4,524 appointments that were cancelled. A significant number of these cancellations were cancer-related appointments. Beaumont Hospital had 3,559 cancellations for the same period. These cancellations are causing hospital waiting lists to spiral. Almost 8,000 people are waiting over 18 months for their outpatient appointments at the Mater Hospital. This is unacceptable and will take a long time to significantly reduce such waiting lists. These cancellations disrupt the work of the medical staff and can endanger the health of the patient, who has to wait longer for a much-needed medical procedure. This is very stressful for both the patient and for the medical staff caring for the patient. What is urgently required is an increase in healthcare capacity. In particular, there needs to be a significant increase in the number of hospital beds. We need faster implementation of recommendations of sláinte care, particularly in terms of delivering care in dedicated external clinics, which would relieve much of the burden on the public health service. Well, we have too few doctors, too few beds and too few healthcare professionals, and a serious lack of real investment in the health service. Then we will continue to have a crisis in the health service and an inability to meet the needs of patients.
Deputy O'Murphy, you seem to be the last speaker now.
Minister, we have crisis and chaos in some of our hospitals and across our health service. We have staff who are under severe pressure, who are doing their utmost to keep the show on the road. We have patients on trolleys, we have record cancellations of appointments, and we have the ensuing increasing waiting lists. But all these issues are people with real lives and with families who are watching their suffering. I'll deal with some of these real lives. A 73-year-old woman who has been having problems with a suspected prolapse womb for around 5 years. Around 3 years ago, she had an appointment with a specialist at the Louth County Hospital, but heard nothing back, and had her next appointment at the Louth on January 20th this year. She had blood taken and other tests, but had been advised that she is on the list for surgery at the Lourdes in Drogheda, which she tells me is supposed to happen in the next 12 months. However, she is in terrible pain, particularly when she passes water, and cannot walk properly at this stage. Following a query from my office, she received notification that she would be advised of an appointment in Q4 or the end of 2023. A 66-year-old woman in North Louth has been waiting a number of months to see an orthopaedic surgeon at the Lourdes Hospital, following damage to her right shoulder, which includes bone damage and 5 tears. Her GP has made referrals into the Louth County Hospital, and she has received an X-ray and following that an MRI scan. She has been given painkillers and has been referred into the very good physiotherapy service at the Louth County Hospital. But the physio there is reluctant to continue to work on her because he is concerned about doing more harm than good. She is in a situation now where her activities of daily living are severely affected. She is not able to shower, do her hair, or dress herself anymore, and she is in a significant amount of pain. She is in urgent need of an appointment with an orthopaedic surgeon. Following a query from my office, she has been advised she will get an appointment date in August this year. A gentleman from Dundalk who is at the end of life, who has a stoma bag fitted and who also has dementia. It is his wish and that of his families to come home. While he's been offered a care package in the community, it does not include anyone to change the stoma bag. With his daughter being told she might be able to learn it herself in order to get him home. The family is under pressure from the step-down facility where he is and from community care in CH08 to take him home without the stoma care. They are not willing to do that, and I'd say that's rightly so. They are being told that there is no one who can do this. But look, we all know that there are HCAs in the private sector who are able to do it. We are still awaiting an answer from COH8. And also, I have made contact with Minister Butler today in relation to this particular issue. We really need to see action on it. We're dealing with people who just want the pain to stop. They want to be with their family, in some cases at the end of their lives. The system is broken. The people are broken, waiting for it to be fixed. Minister, this isn't good enough. We owe the people better.
Minister, firstly, I just want to say this is a timely and necessary motion when we consider the state of our health service and the failure of the current Health Minister, Stephen Donnelly, unfortunately is not here to make any meaningful steps to address this crisis. In Limerick, at University Hospital Limerick, our hospital is operating in a crisis and has been for the entirety of Minister Donnelly's time as Minister of Health. Indeed, it's been in crisis since Fine Gael closed down the emergency departments in Ennis, Nina and St John's Hospital without delivering additional capacity and the needed capacity in University Hospital Limerick. In Limerick, we have what's called the Full Capacity Protocol, which is designed as an emergency measure to deal with overcrowding. It results in patients being placed in inappropriate areas of hospitals, overcrowding on wards, the cancellation of elective procedures and aggressive discharging practices. The protocol was not intended and was never intended to be used every single day or to become the norm. While the protocol was used 30 times in 2011, the year Fine Gael took office, it was unfortunately used almost every single day in 2023. As of 30th of April, the full capacity protocol has been in operation for 118 of the 120 calendar days of 2023. The need, and I accept that there is a need to use the protocol sometimes so frequently, shows there is major issues at our hospital. The Minister should be aware of what they are: capacity and staffing challenges. The frequent use of the protocol impacts patients across the hospital. In the first quarter of this year, 2,520 appointments were cancelled at University Hospital Limerick because available resources are diverted elsewhere. These are people who have been waiting for hospital appointments, many of them for many, many years, with no date of when they're going to be rescheduled. People who were actually ready to go to the hospital, and in some cases people who were prepped to go to the hospital, had appointments cancelled. This is not a new issue. The challenge facing staff and patients at University Hospital Limerick has been well highlighted by myself in this chamber since my inaugural speech in this stall in 2016. Of particular concern to me has been the number of people that are treated on trolleys and hallways in UHL, the challenges that this proposes to the staff and the patients themselves. Today at University Hospital Limerick, there's 81 people being treated on trolleys. For the year to date, the figure is 7,747. These are incredible figures which, if not tackled, 2023 will outpass the disgraceful numbers on trolleys of 18,012 in 2022. The trolley crisis, where Fine Gael pledged to end the scandal of patients on trolleys, is worse than it ever has been. It is a capacity and a staffing challenge in UHL, and while there is currently the construction of a 96-bed unit, this will only provide an additional 48 beds. Plans are afoot for an additional bed unit, but this is still at the pre-construction stage. This needs to be expedited. The health professionals at the hospital work very hard, but in many cases they're understaffed, and this is a risk to both patients and to staff. In recent weeks, nurses at the ICU embarked on industrial action to highlight that in their section they're almost 25% short of the necessary staff. With the challenges that are faced at the hospital, is it any wonder that people are leaving our hospitals prior to being admitted? In the first 3 months of this year, 1,527 people left the hospital. They presented themselves at the hospital, they registered, but they never got into the ED. This is an absolute disgrace. These are 1,570 people who were sick, went to hospital, but left because they felt better off going home. The crisis facing our health service is not an intractable one. It requires work and planning, but things can change. What is needed is a multi-annual plan that is backed by a strategic workforce planning to tackle the trolley crisis across the state. The Minister plans to deliver 1,500 beds over the next few years, yet the ESRI tells us we need 2,500, so he's already planning to fail. We need the availability of transitional care and recovery beds outside the hospital settings. These need to be increased, as does the access to home care.
will need to change, but it's change that I don't believe the Fine Gael-led government has the will or inclination to deliver. And just before I finish, I just want to mention the mental health de-escalation unit was supposed to be up and running at the end of 2022, and we still haven't got that delivered. So,
Deputy David
Gurmagat. Minister, behind all of the facts and numbers that were presented in both the Sinn Féin motion and the counter motion from the government are real people and their experiences, and we heard many of those stories shared tonight by deputies from right across the political divide. Older people whose stories were shared of their experience of waiting sometimes days on end on hospital trolleys. In fact, many of them now don't even make it to a hospital trolley. They're left on chairs in emergency departments for 24 hours and in some cases days on end. Children who are waiting over 13 hours in emergency departments. People over 75 waiting longer than people under 75. It's just quite extraordinary. And then people who've had their procedures cancelled. Outpatient appointments, hospital procedures, some of them cancer procedures. And all of this in 21st century Ireland. And despite all of the boasting in the counter motion put forward by the government, that's the hard reality and the harsh reality for far too many patients. Our motion set out alternatives which this government, in my view, should take on board. And as one of the deputies said earlier, it's like Groundhog Day when we have debates on housing and health, because since I was elected to the Dáil in 2016, and I would say well before that, there has been any amount of debates in this House and outside on the need to reform our health service and the need to ensure that we have a health service that's fit for purpose. But yet here we are with all of those stats going in the wrong direction of growing waiting lists for acute hospitals, waiting lists that are extraordinary, nearly 220,000 plus people waiting for a diagnostic scan, over 200,000 more people on community health waiting lists, and nearly 800,000 people or more on acute hospital waiting lists. The mind boggles when you consider the numbers, but as I said, real people behind them all. We have to start by putting the capacity into hospitals, Minister. Stephen Donnelly talks about more beds, Minister Donnelly, but there's no urgency in terms of when that's going to happen. There's promise after promise after promise, but many hospitals who've been screaming for hospital beds, like the Midwest and Limerick Hospital for years, simply have not got those beds. We know we need more beds, but we also need more surgical theatre capacity. We have consultants who in hospitals are fighting every day between themselves for access to very precious surgical theatre capacity, and that's holding up many medical procedures being carried out. We have far too many people waiting for a diagnostic scan because we don't have public capacity. So, of course, we need capacity in our public acute hospitals. But we also need to see investment in primary and community care. Anyone that has any understanding of what's happening in emergency departments knows that part of it is hospital capacity, but also part of it is we're not providing the right care in the right place at the right time. People who should be cared for in the home are not being cared for in the home because we don't have the home support packages and the intensive home care packages. We have people who have chronic pain and chronic conditions who should be managed in the community. That doesn't happen. We have many community intervention teams which are not fully staffed. We have people who can't get access to out of hours GPs. We're not making best use of community pharmacists, particularly out of hours. We don't have enough step-down and recovery beds. We don't have enough rehabilitation options at home to treat people at home. All of those are failures in primary and community care, and because of that drives more people into emergency departments. But we also need to underpin all of that, all the additional investment, a comprehensive strategic workforce plan that once and for all deals with the recruitment and the retention crisis that we have in healthcare. The Minister had to acknowledge that he couldn't deliver the beds and many of his promises that he made because staff couldn't be recruited. Last year we funded 10,000 additional places for healthcare workers. 5,500 could be recruited, the rest could not be. And here's what the Minister said in his counter motion today. After years of talking about a recruitment and retention challenge, he says, discussions are ongoing between the Department of Health and the Department of Further and Higher Education regarding the expansion of student places across health-related disciplines. And God Almighty, after all of the years that we've talked about the need to ratchet up training places, to ensure that we have a greater pool of graduates coming through, that we actually have the people to fill those children's disability network teams, 1/3 of those teams are still vacant, and tomorrow, Minister, you'll hear of very horrendous wait times and numbers of children who are waiting on those teams right across community care, but also in hospitals where we can't recruit staff. And there's going to be discussions between the two ministers. No sense of what that means, no urgency, no plan. They're going to have a chat, it seems, rather than come into this House, which he hasn't actually done. And I know he's abroad, but it's standard practice that if a minister, senior minister, can take a motion, he would at least have the manners to contact the proposer of the motion to explain why. None of the ministers for health, junior or senior minister, were able to make it here today, and I think that should be noted, and I think it is wrong. So, Minister, as far as I'm concerned, this Minister for Health has not delivered. He has no multi-annual plan, and in my view, he's failing patients and he's failing those who work on the front line in healthcare.
Well, good. Now that concludes the debate on this motion, re-hospital waiting list. And you see, on Kesh Nishna Gonen Tofer and Lasso, the question is that the amendment be made. Is that agreed? Is that agreed? Not agreed. Okay. Na chakti atar hivna Kesh ta abrigita. Na chakti atar na gwena abriginil. Is the ogwell on Kesh richer. Both. So a division has been called and it's deferred until the weekly division time tomorrow.